how can we say things? How can we use our voices for good?
Good morning and welcome to Recipe for Success. My name is Nancy Giacalone, and if you are joining me for the first time, the reason that the podcast is titled this is because I actually really love to cook, and I think that there's a lot of similarities in making something successfully in the kitchen and making something successfully in business and life. There's always a special ingredient or technique that is really critical to the outcome. This morning, I'm super excited to have Dr. Ashley Shrader as my guest. I actually have to read this off the piece of paper. I don't like to do that, but I'm going to get it wrong if I don't. So, Ashley is a board certified family nurse practitioner, an IFM certified practitioner, and a registered yoga teacher. I got tired just saying all of that, Ashley. That's a whole lot. We're going to talk about functional medicine today. But I was first heard about functional medicine, I'm going to say it was about 10 years ago. And I remember being at a conference and it was a conference around healthcare, and somebody had stood up and talked about her own journey with functional medicine. And it took root in my brain. And so I wanted to know more about it. I still didn't have a full understanding, but I ran across something that Ashley had done recently. And I'm like, I need to get her on the show so we can talk about it some more. So, without further ado, Ashley, would you like to introduce yourself to our audience and tell everybody a little bit about yourself and your background?
Sure. So I am a functional medicine practitioner. I transitioned into functional medicine after working in a more conventional setting, the emergency department, urgent care, primary care, for several years. I was inspired by the idea behind functional medicine because of my own personal health journey. And so being a yoga teacher, I integrate a lot of the mental, emotional, spiritual aspects of healing with my treatment plans when I care for my patients. I'm originally from Florida, lived in DC for a long time, and then we moved out to the West Coast of 4.5 years ago now. And we're not looking back. We love living in the mountains.
So, just out of curiosity, before we dive in, do you find that people's expectations or their investment in their own personal health is greater on the West Coast than the East Coast?
That's a good question. So it's interesting. What I found in Oregon is their patients are actually very informed here. They know about functional medicine. They know about integrative health. There's a lot more insurance coverage for that kind of care out here. And so the patients being more informed are I'd say they're more likely to know how to work the system, to find those practitioners that know functional medicine and that are taking insurance. They know how to work with their insurance companies to get coverage because a lot of functional medicine practices are cash pay. So it's just a different type of population. A lot of my existing practice is virtual and also on the East Coast, based in Washington, D.C. area. And those patients, functional medicine is really new. There's not as much supply of functional medicine and integrative healthcare out there. And so I'd say just those patients, because they're less informed, it's a little bit harder for them to kind of navigate the system and determine whether or not they're going to pay cash or use insurance. Yeah.
Okay, so let's talk about what exactly is functional medicine. I mean, we're tossing the term around with the assumption that people know what we're talking about. So let's define what it is and what it means to you.
So yeah, most people aren't familiar with that term. So functional medicine is truly a root cause based approach to healing. So when a patient comes in with a symptom that is affecting their quality of life, rather than jump immediately to putting a Band-Aid on that symptom, which is typically in the conventional approach, a medication based on an algorithm. We are asking more questions to get to the bottom of the root cause of the symptom. And many times it's multifactorial. Many things are going on. So this approach really serves patients with complex chronic symptoms. So like chronic fatigue, fibromyalgia, chronic pain, a lot of like mood disorders, depression, anxiety, those types of things. Those are really well served by a functional approach as opposed to like, here's an antidepressant, like sending someone on their way.
So, how would somebody know if a physician practices functional medicine or not?
Yeah.
Because it's not always clear.
Exactly. Yeah, that's a great question. So there are a few different organizations that are certifying bodies for functional medicine practitioners. And so most physicians that are practicing functional medicine have at least taken one course with the Institute for Functional Medicine. And so you can go to that website, ifm.org, and look at the Find a Practitioner directory. And there you'll see practitioners who are certified, who have gone through the entire process, taken the test, done the case study. And you can see practitioners who have even taken just one course. It's just, if somebody's shown some interest, they're probably going to be taking that type of approach with you. So I would say they don't have to be certified, but looking for someone who has that interest in functional medicine is key.
Why do you think that most conventional medical practitioners only look at the symptoms and don't actually ask questions to help get to the root cause?
So, having worked in that setting myself, and understanding what the demands of the pace, to like fit as many patients in per day as you need to, really the safest approach is an algorithm. So you've got to put a patient into a box, and hopefully they fit into that box nicely. And it's a clear choice of a medication that works well for them. And that medication is hopefully covered by insurance. And then it all fits into that system really well. And for many patients, that actually works just fine. Like it's perfect. But I'm finding that a lot more patients, just like myself, they're like me, they want to know more behind what is causing the symptoms.
I find that really interesting. I'm going to throw my mom under the bus. She's probably listening to this podcast. So, Mom, we're talking about you. She is in a stage of her life where she has multiple things going on. And no one is talking to her about the root causes. And this is one of the conversations I had with her recently. My sister and I did. Like, okay, Mom, we're going to go to the doctor. Yes. So, in case we were wondering, she is listening. So,
That's
one
amazing.
one of the concerns we have is that no one's actually talking to you about what's causing this. They just want to keep putting a Band-Aid on, and none of these Band-Aids seem to be working.
Right.
And so I really have a deep concern about the primary care system in our country, especially as it relates to our senior population, because they start having these multiple things going on. And it's just, here, take this medication, without any consideration that there might be one thing that's causing all of these symptoms. If they could just figure out or I should say this, if they could just take the time to figure out what it is.
Exactly. Because I truly believe that most practitioners get into healthcare because they want to help people.
I agree.
At a certain point, it is really just demoralizing to come to work every day and not be able to help to that degree that you want to. And so that's why there's just such a high rate of burnout in primary care. To really get to the bottom of somebody's symptoms, it takes a lot of time, as you're suggesting. Like those visits in functional medicine are 60 minutes to 2 hours. Like they're really long and intense. And we're diving into birth. Like we're going back to, were you breastfed? Did you take antibiotics as a child? We're looking at the onset of your symptoms and like what factors were going on in your life that correlate with those factors. So doing that type of a history takes a really long time. And yeah, that's just not, primary care is not built for that.
So I warned Ashley in the couple minutes where we were in the quote unquote green room before we came on that I always give an outline, but I've been known to go off script. And so I'm really throwing curveballs at her right now because I've got another one for you. One of the other areas that I'm very particularly interested in is pharmacogenomic testing for prescriptions, because I think this ties into what you're doing, particularly when it comes to mental health, because so many drugs that are prescribed for depression and anxiety are completely the wrong drug and may exacerbate conditions. And if we take the time to understand a person's health foundational history, as well as maybe put in that extra step to determine the right drug the first time, we would see so much improved outcomes from the way that we're treating people.
So true. Yeah. Even in primary care, those are tests that are actually your primary care practitioner should be able to order those, and you can ask your primary care provider about those. But I agree, those pharmacogenomic tests are amazing, and they can just take so much of the pain and the suffering out of finding the right medication. Also, they'll test for more functional genomics that we use. So, like many people now are talking about this MTHFR gene, which there's really good evidence showing that having that enzyme deficiency does contribute to treatment-resistant depression. And if you treat that with folate, so simple, you can actually see much better outcomes in those folks with treatment-resistant depression. So, and typically that test is run in those tests you're talking about. So I love them. I think that is, that's precision medicine. That is functional medicine. Genetics are a big part of it.
And for anybody listening that is not in our crazy healthcare world, those tests are not expensive, particularly when it relates to mental health medications. If your insurance doesn't cover it, ask what the cost is, because typically they're under $100, and it can improve the efficacy of the prescription so much faster than if you just go through the trial and error process. There's also some new precision medicine testing. Again, it's testing for genomic markers as it comes to biologics as well, because a lot of people that are suffering with rheumatoid arthritis or psoriatic arthritis or some of those things, those drugs work along different neural pathways. And if you put them on the wrong one to begin with, it reduces the likelihood that the second medication is going to be as effective.
Wow.
So some of those things that we can do to advocate on our own behalf, even if your doctor isn't suggesting, ask them, do you do this? Can you refer me to someplace that can do this? Because it's a very small investment and a huge potential outcome that can help improve your health.
Exactly. Yeah. I think it's scary for patients to, hopefully patients are in a situation where they can ask their practitioners about tests like this, that they're not like the practitioner's ego is not, like an insecurity about not knowing is not going to get in the way. So that is something that I'll always recommend to my patients, is finding that practitioner that is willing to just listen to you and doesn't have that like kind of shield or insecurity shield anytime you bring a new idea into the picture.
Well, speaking of testing, you also have a personal experience with functional medicine from your own personal standpoint, and you had some tests done, and you discovered that you have an autoimmune disease and you're predisposed to ALS, often known as Lou Gehrig's disease. Can you talk about that a little bit?
For sure. Yeah. So the autoimmune disease. So this was back in my 20s, right around the time that I was entering healthcare. I had shifted gears in my career. I used to be a consultant and then moved into healthcare just from like I was in a bike accident, had this experience where I was just really inspired by the healthcare providers that I had seen. So I got into nursing, and around that time, there was a lot of stress. A lot of things were happening in my life that contributed to this process kicking off, including genetics. But I started getting really weird symptoms, ringing in the ears, fatigue, insomnia. And I was in my 20s, like I shouldn't have been having those types of symptoms. I was diagnosed with, it was Hashimoto's. I was given a medication and just said, like, there's nothing you can do. Don't worry about it. Just take the medication for the rest of your life. And as like a 20-something-year-old, I'm thinking, what? Are you kidding me? This is our healthcare system. Like, this is the answer. And so, with the internet, I went down my rabbit holes and I learned about functional medicine through that process, and was really inspired to become a nurse practitioner just by learning about functional medicine and the ability. There's just so much potential for healing and for really understanding why a disease presented. And now looking back, and having had seen a functional practitioner getting blood work done, I can point to exactly what it was that caused that autoimmune process to begin. So I'm grateful for that experience, because I wouldn't be here. And I've learned so much about my health and really, especially on the stress management side. I think that's probably one of the biggest factors for me in developing that process. So Now, fast forward like 20 years later, I'm in my 40s. My mom is diagnosed with ALS. This was in 2021, so pretty recent. And she was like, it was a really fast process. It started, it's called bulbar onset, with slurring of the speech and unable to swallow. And so when it starts there, it goes into the diaphragm pretty quickly. So you don't breathe very well. And so it was like a year and a half, and then she had passed away. And so during that process, she had some genetic testing done, but it wasn't the full panel. But I, being like an investigator, I went and ran my own genetics through Promethease online,
Yes.
and saw that I had this gene related to ALS. It's called ALS11. And so I talked to her neurologist about it. They ordered the test. We didn't get that test. It's like she had died, and my dad had to like pull the saliva from her suction, to be able to get that test run. But thank goodness we did, because this means my daughter's going to get tested. I could get tested. And so I did have like the formal genetic test, and was given that news that I have this ALS11 gene. So being a functional medicine practitioner, I wanted to do whatever I could to improve my brain health. And really, again, it's the mental, emotional, spiritual aspect that can make such a difference in terms of longevity. And I think this is for many people. So that is really balancing that with my there's a side of me that likes rabbit holes and likes to do whatever it can. It can lean towards anxiety. So this was an experience where I was able to work on my brain health, work on that mental, emotional, spiritual health, and find a place where I'm happy with where I'm at, and I'm living every day to the fullest, and living for my daughter, and knowing that I've done everything I can to be healthy.
I love that. I had a hip replacement done in December, and some of the aspects of the whole healthcare situation, because it was really one of my first major surgeries. And so it was very interesting. A lot of it was not great, but my my orthopedic surgeon, I have to say, I definitely need to give him props, because one of the things he really spent a lot of time talking to me about was thoughtfulness and meditation. And he's like, it will really, he says, it will calm your system and it will help promote healing. And I was shocked. I mean, this is a
What?
guy that's going like this, and he really took the time and sat me down, and he's like, I can already tell. He says, you're a doer. He says, he says, let's take a beat here. And he says, you need to take some time to calm your body, because if you do that, calm your body, your mind, your spirit. And he says, it will allow you to heal more quickly.
It's so true. It is so true.
And I
Oh
was
my
I
goodness.
was really pleasantly surprised by that information, and then, of course, proceeded to keep doing, but I keep thinking about that. I'm working on it. Um, okay, I'm trying to decide whether to do this question. I'm gonna do this question first, because I've got one that you and I chatted about. There's an elephant in the room, what we're gonna approach in a minute, but so whenever I have a guest on, of course, I am the researcher. I'm like, okay, well, I want to know everything I can about this person. I want to know everything I can about what they do, so we can have an interesting conversation. And one of the things I found on the Institute for Functional Medicine's website was a really cool graphic, and I loved it. And it said, one condition, many causes; one cause, many conditions. And I thought that was brilliant, because it had a nice little graphic with a big circle and then all the little circles around it.
Yes.
Let's talk about that for a minute.
Yeah, I love that. So yeah, it helps to think about an example, right? So I like the depression example. Depression, I see this all the time: nutrient deficiencies, gastrointestinal disturbance like IBS, neuroinflammation from an upregulated immune system. So just inflammation coming from whether it's insulin resistance, chronic stress. So typically with disease like depression, we're seeing multiple different factors that are contributing to it. And so that is the reason for that really in-depth history taking in functional medicine, is to determine what labs you're going to order, where do you need to dig a little deeper to figure out what is causing it.
I have a good friend whose mom is going through a similar situation as mine, and she was going to do a very in-depth health analysis, and her mom was like, "Well, why did they want to know about my mental health? Isn't this going too far? It's not appropriate for my
Wow.
medical conditions." But
Wow.
I think from what we're talking about is it's all tied together.
Exactly. Exactly. This is the reason why, yeah, I do what I do. If we want to see somebody truly heal, and no one's ever like perfectly healed, we're always going to struggle with different health concerns. But to really someone become truly resilient and empowered in their health, they really need to understand and be accountable for every single aspect of that, and that includes the emotional and the mental health.
I love that. Okay, so now I am going to tackle that 800-pound elephant in the room that nobody wants to talk about because it's very sensitive. But I would like to talk about the new obesity medications, the GLP-1 drugs, Ozempic, Mounjaro, whatever name, Wegovy, whatever name you might be seeing them from. And the reason I bring it up is I'm not opposed to them at all. That's not my issue here. But I was listening to a podcast this morning about this particular phenomenon and how quickly these drugs have risen in popularity. And my concern is, again, not that people are taking them, but my concern is, are we putting a Band-Aid on a symptom again and not getting to the root cause?
Well, that is well said. So, I have prescribed those medications. I'm not against those medications. They work wonderfully, especially in diabetics, especially in like it's a better option, I'd say, than some of the other drugs that are used for obesity. However, the true issue and the evidence really reflects this is that when the person stops the medication, the weight gain returns. The other issue is we're seeing a significant loss in muscle mass with prolonged use of the medication. And lean muscle especially, has such a profound impact on longevity. Like, we need that muscle for our bone health, especially. So when we're thinking about, a lot of the people that are using these medications are women. And so we've got to think about the potential implications on bone. And we've got to think about, okay, if this person is going to be on this medication for the rest of their life, what are the financial implications of that? Yes, but also how is that going to impact their longevity? Whereas we kind of talked about this before, but thinking about before initiating a medication like that, really understanding how the individual got there in the first place. So understanding their genetics, understanding their stress. Really, stress is a huge factor in this. Understanding what's happening with their insulin levels, their leptin levels, and what is their motivation level to make changes on a diet and lifestyle basis. Like, if they've got to be motivated or they're never going to come off the medication. Yeah.
Well, there's concerns not only for long-term side effects, which we don't know what they are yet, but also the long-term effects on our being able to finance our healthcare system, because these drugs are not inexpensive.
Exactly.
And they're averaging around $1,000 a month per person, and I've seen estimates that over 50% of the population would qualify for these drugs.
Oh,
We
wow.
can't afford it.
No.
We can't afford it, and so somehow we have to get to the root cause of why, as American citizens, as adults right now, we're on average 20 pounds heavier than people our age were 20 years ago. And if
Yep.
that continues to compound, a drug isn't going to solve that problem. Again,
Mm-mm.
I am not opposed to these drugs, so please, that is not the discussion. My concern is what's causing this, and how do we use these to bridge to a healthier lifestyle?
I agree. Yeah, I
So
completely agree. Yep.
I think it's a little bit scary. Okay,
Mm.
so again, I'm the website searcher. So on your website, it says conventional medicine asks, what do I call this disease, and what medication can I use to treat it? Functional medicine asks, why do you have this symptom in the first place? And how can we restore function? I think this is brilliant because people always say, well, what do you have? What did the doctor say you have? What are they giving you for it?
Yep. This is so
No,
true.
I mean, I probably said those words to somebody before. So I know that that's our common thought. So how do we reframe that?
Okay. I love that. So yes, with the conventional approach, there is this labeling that happens, labeling of symptoms to get to, like, it's that diagnosis code. Everything is driven by an ICD-10 code. And that really is, yes, like that puts a label in the patient's head on, like, they identify with that diagnosis. Number one, they believe in that diagnosis, and that is like a part of who they are. So I just think there's a lot of trouble with that too, because when patients get to me, many times they believe that, like, they are that, and they can't and they cannot get away from that, like, identifying. The approach with functional medicine is, again, thinking about how we're going to put some resiliency into that person, like how they are going to heal in a way that they are going to approach the next stressful event in their life, and not have a complete, like, collapse in their health. That they're able to move through the inevitable stresses of life, without having, like, those significant impacts on health, which I think is probably the stress is one of the biggest contributing factors to chronic disease that we have today.
So along those lines, again, this isn't on my list because I just pop this stuff in my head when we're talking. So I know that stress is a huge issue, but I really believe that inflammation is a huge issue as well for so many of these diseases. And a lot of that comes from our environment, our diets, our exercise, all of that. How can people work to improve their stress levels, their inflammation levels, et cetera? What would be some practical steps people could take?
I love that. It's really simple. If you're thinking about the things that you're taking in the most, so your air, the air quality in your home and your work. So just understanding a bit more about that. And many people who have, like, symptoms that would make me believe that there is something going on with air quality, just like a good air purifier can work really well. Water, reverse osmosis, or one of those Berkey filters. If you went to, Environmental Working Group, ewg.org, if you went to that website and just looked up the water quality in your town, I guarantee you would be shocked. You would not
I don't think I want to do that
there anymore. So I do think water filters are critical. Whether you have like, we tested our well water here.
We have well water
and it
too.
had arsenic in it. Like, and it's just, like, shocking. It's really either get your water tested or just go ahead and get a filter. Those are two simple strategies that can be relatively low cost, and have a big impact on health.
Okay, well, I'm going to let you off the hook now because I have asked you questions that weren't even remotely on my list. So
Well, I love that though. They're good.
We'll get to the fun part of the show, which is my 5 burning questions. Are you ready?
Ready.
Okay. Number 1, what is your absolute favorite food in the world, and can you cook it?
My favorite food I love is sushi. I cannot cook it. I have a husband who does all the cooking in the house. He used to own
Lucky you.
restaurants. I'm so lucky. See, I call him the houseboy here, and he's
That's amazing.
wonderful. Yeah. So, but I can't cook it. Yeah.
Okay, but in Ashland, do you have good sushi?
Yes, we do.
Okay.
There's actually a place in Jacksonville, Oregon that we really love. It's a smaller town out here, but yeah, and there's a great place in Ashland too. Yeah.
Okay, good to know. I'll keep that in mind. All right, so this is an interesting question. What character trait do you most admire in other people, and why?
I love vulnerability. I think as a practitioner, showing some vulnerability is a really great way to connect with patients, to get some of that extra information from them. I love when my practitioners are vulnerable, and I love when my friends are. I just love anybody who's willing to be vulnerable. I just love it. I feel like it just allows connection on a better level. Yeah.
So if I flip that mirror on you and I say, what character trait are you most proud of in yourself and why? What would that be?
Ooh, that's good.
Mhm.
I mean, I guess that's probably one of them. I do, I share my personal story with my patients all the time. I share symptoms that I've gone through, my journey, and I think that that helps because people feel so alone, so often in their health journey. Yeah.
Okay, well, you just led me right into my next question, which is what is one thing people can do to improve their healthcare experience?
Okay, that's a good one. I would say finding a practitioner, like your primary care provider, finding a practitioner that is going to listen. Empathy has been shown again and again to be more powerful, more potent than drugs. Like empathy. So if you can find an empathetic practitioner, that in itself is going to be therapeutic for you, and they're going to listen, and you're going to bring them ideas, and they'll consider them, and they won't shut you down. So I'd say finding that right practitioner is key.
I think that's a really interesting comment because I've read studies about people in hospitals where the nurses are more or less empathetic and how quickly the people recover as a result of that additional care and empathy.
And it makes a huge difference.
Yeah.
It's crazy. Yeah.
Um, okay. So this is a fun one. So, what is your secret talent or something people would be surprised to learn about you?
I practiced gymnastics growing up, so I can still do handstands. So anytime I am like we have a group of friends, anytime we are at a wedding, I always challenge one of my friends to a handstand contest, and I win about half the time.
That is a great one. I wish I had something that cool. No one would ever want to see me try to stand on my hands. I'm the least coordinated person on the face of the planet. Um, okay, last question. So, who's the one person, living or not, um, famous or not, that you would most like to sit down and have a conversation with, and why?
That's a good one. So I'm going to get a little vulnerable here. It sounds like such a hippie response, but I read this book again and again after my mom died, called "Walking Each Other Home," and it's by Ram Dass. And it's like him and this other author, Elizabeth, having conversations about death and dying, and it took away so much of the fear surrounding the dying process, and just thinking about my own mortality, but then also like what it was like for my mom, and and death itself, and that it's not something to be feared. It's actually can be beautiful, and yeah, and so Ram Dass, the author of that, I just felt really connected to him as I read that book, and so I'm always thinking like, gosh, I wish I could talk to him if he were still alive. Yeah.
That's a wonderful answer. I actually love it.
Aw.
Okay, so if people want to learn more about what you're doing or get in contact with you, what's the best way for them to reach you?
Sure. So my website is risefxmed.com. So you can email me through that website. My email is ashley@risefxmed.com. So yeah, any questions about functional medicine, or if you're looking for a practitioner in a place where I'm not located, I will always help you find somebody. So you can always reach out if you have questions about functional medicine, or how to find a practitioner.
That's amazing. Well, thank you so much for joining me today, Ashley. This was a very fun discussion. Um, I can't recommend people like Ashley enough. It's really important to understand how your body works, and why it's doing the things that it's going to do if you want to have effective treatment. So, thank you for joining me today. I will be back next week. Until then, everyone have a fantastic week. Thanks again.